Hi there, I'm Dr. Jesús Lemus, and I want to talk with you about what to do after being discharged from the emergency department for a headache. I know headaches can be frustrating and sometimes even alarming, but I want to reassure you that today's evaluation did not find anything urgent or life-threatening. That being said, it is still important to take care of yourself and pay attention to how you're feeling. Headaches can happen for many different reasons: stress, dehydration, sinus infections, or even just a long day of looking at a computer screen. If your headache is linked to something like tension or mild migraine, simple things like rest, hydration, and over the counter pain relievers can help. Be sure to take any medications exactly as directed and avoid anything that might trigger your headaches, like bright lights, strong smells, or too much caffeine. One of the most important things you can do is give your body time to recover. Try to rest in a quiet, dark space if your headache has not fully gone away yet. Stay hydrated and make sure you're eating balanced meals. If you spend a lot of time on screens, take breaks to reduce eye strain. And if stress is a factor, deep breathing, light stretching, or a short walk can sometimes make a big difference. While most headaches are not a sign of something serious, there are times when you should seek medical attention right away. Sudden severe headache, also known as a thunderclap headache. If your headache comes on suddenly and feels like the worst pain of your life, this could be a sign of a brain bleed or another serious condition. Weakness, numbness, or trouble speaking. If you feel weak, numb, confused, or have difficulty speaking or understanding others, this could be a stroke. Get help immediately. A headache that keeps getting worse. If your headache does not improve with medications or gets worse over time, you should be checked again. Fever and neck stiffness. A headache with fever, stiff neck, nausea, vomiting, or sensitivity to light could mean a serious brain infection like meningitis. Headache after a head injury. If you hit your head in a fall, accident, or any other trauma and now have a worsening headache, it could be a concussion or a brain bleed. Seizure or passing out. If you have a seizure, faint, or lose consciousness, return to the emergency department immediately. Very high blood pressure with headache. If your blood pressure is extremely high and you have a headache, you may be at a risk for a stroke or other serious complications. Severe nausea and vomiting. If you're vomiting a lot and are unable to keep fluids down, this could be a sign of increased pressure in your brain. Vision changes. If you experience blurry vision, double vision, loss of vision, or eye pain, get checked out right away. If you have a serious medical condition, if you have a history of cancer, HIV or AIDS, a blood clotting disorder, or recent surgery, and develop a new or unusual headache, return to the hospital for a reevaluation. If you've had frequent or severe headaches in the past, following up with your primary care provider or a neurologist is a good idea. They can help figure out if there's an underlying cause and work with you on a long-term plan to manage your symptoms. Remember, you are not alone in this. Your health is important, and I want you to make sure that you are feeling safe and supported. If you have any questions or concerns, you can find your emergency department's contact information in your discharge paperwork. And if anything feels not right or you are unsure, do not hesitate to contact your primary doctor, call 911 in the United States, or go back to the emergency department. Thank you for your time, and I wish you a speedy recovery.